Dr. Mohammad, so excited to have you on our show.
Thank you for having me.
Now, when we talk about disabilities, there have been so many changes in the last several years relating to how people refer to individuals with disabilities. So we used to use, back in the day, maybe I'm dating myself, but back in the day we used to use the term handicapped. And now that's not really used very much. Now we use the term disabilities. Tell me about some of the debates that are happening within the community, within the disabled community, around terms, around how they should be referred to.
So it's a really good question, and I think what's happening is that there's an evolution that's taking place in the language that's used, and at the same time, there's different conversations that are happening in different environments, right? So the medical community might be talking about certain things a certain way, the disability community might be talking about things a certain way, but the two sort of broad discussions that are taking place right now are, whether we should be using something that's referred to as person-first identity, or whether we should be using something that's referred to as identity first, right? And so this whole idea that, do you say that this is an individual with a particular condition, right? And so if we were to take autism as an example, do you say this is an individual with autism spectrum disorder or an individual with autism, versus do you refer to that as an autistic person? And so you can see that there's a nuance there in terms of, how the language is used and what the meaning of that will be for that particular individual. Definitely over the years, the term handicapped has definitely left the discourse, and that's partly because of an awareness that we want to look at people and individuals as who they are and what their strengths are, recognizing that they probably, do demonstrate some challenges in different environments, but how can we continue to empower them? How can we think about them? And again, that conversation looks very different in different parts of the world. It might look different in different professional groups, and so and it's an ongoing conversation. Right?
I noticed that in the UK they use the identity first approach. In Canada, the person first approach is more common. Can you tell me a little bit about what that means? Like, what does person first entail? What does identity first entail? Yeah,
I think part of it is, if we think about adjectives and how we describe people, right? I think, our understanding of the different neurodevelopmental conditions is changing. And I think because we want to shift our focus to thinking about, what is a person able to do or who is that person, rather than sort of earmarking them as having, a particular condition with these challenges, it gives us an opportunity to see the person to whom some of these issues might be attributed towards, right? And so when the person-first identity, if we take an individual and we say the individual has a particular neurodevelopmental issue, you're recognizing that this is a full human being who happens to have certain challenges. And so the challenges are secondary to who that human being is. That's a person-first identity. An identity-first situation, when we think about kind of that language, is recognizing that, there's a continuum of strengths and a continuum of challenges that somebody might have. And, we want to acknowledge that part of who they are comes from that awareness, right? That recognition that, yes, if I'm an individual with autism or if I'm an autistic person, again, I'm not necessarily speaking from that perspective because that's not my experience, but this idea that, I see the world a certain way, and the big world, the global world, is perhaps not structured that way. And so I want to recognize that the way that I see it is also important compared to what, sort of a neurotypical person might be seeing.
And I guess they can't necessarily disassociate themselves from that, from autism, for example. It's part of themselves, right?
Absolutely, yeah. And I think that brings up, again, one of the things that comes up often is this emerging trend of neurodiversity movements. And neurodiversity movements recognizes that even our development as human beings and the ways in which we look at the world is on a continuum, right? And so autism, again, using that example, may be considered, again, exemplifying a neurodiverse condition rather than a disorder. right? And again, that's where the language again becomes important, is that at what point do you draw the line and say that this is a condition that's a disease or a disorder versus it's just part of the continuum of all the humans that are around, and there's going to be some individuals on this end of the human spectrum, and then there's going to be some individuals on the other end of the human spectrum.
It seems from what you're telling me is that there's a limitation in terms of the language that we're using, because some people are upset with the use of some language, and then some people want us to use other language. So how do you or anybody who's trying to navigate the discourse, how do they deal with people with disabilities? What's the best way to address them?
So that's an excellent question, and I think it's a challenge among clinicians specifically, because families are coming to us with the awareness that there is this discrepancy in how people are thinking about it. Part of it is influenced by what people hear about in the lay media, right? There's a number of different TV shows and stuff that talk about individuals on the autism spectrum as an example. I think the way that we want to think about it when we're talking to families is that what do the strengths and the challenges of a particular individual mean for them in terms of their functioning in society. And so I think about, and I always tell families that, for instance, when I'm seeing them in clinic, I'm seeing them in a very sort of hypothetical scenario. It's a very kind of contained environment. There's a certain amount of demands that I'll place on that particular child or youth, for instance. That may shift as soon as that particular child or youth goes into school. That might shift when that child or youth is at home or interacting with extended family members. So the way that we want to think about is that if there are aspects of a child's development that are different, what does that mean for their ability or inability in certain situations to be able to function in different environments? And so how do we support that? In some situations, having a diagnosis of autism is going to be supportive of the child within the school system, for instance, right? At the same time, it may pose certain stigma that, again, I think in Canada we're lucky because there's been a much greater awareness of autism and other neurodevelopmental issues. But you want to sort of have that conversation with families to say, okay, what's the best way that we can help this child given the different environments that that child has to function within? And if we think about it that way, I think that eases the tension there about, do you call it this or do you call it something else, or where do you draw the line? Are there quote unquote milder symptoms versus severe symptoms? That language has its own challenges. So there are a number of things to think about in that setting.
And then, we've been talking about the English language, but, what about if you interact with individuals who are from a different country or have a different language? Then even the term autism might not translate very well into other languages.
Yeah. And again, what's really exciting about that, if we step away from autism for a second, in some cultures, the game peekaboo that we're very familiar with doesn't have an equivalent term. And it might be something that people play a lot, but just to use a simple activity that many of your viewers might, for instance, be familiar with, that we play with growing children, that term isn't captured in other languages. So if you extend that as an example of something about our development, and now you bring it up to a level where you're saying something is different about a child's development in terms of a disorder or a neurodevelopmental condition like autism, what's fascinating, and I think it's sort of a space we have to learn a lot more in, is that the word autism doesn't exist in most languages, right? So what I say autism, you might interpret it a certain way, but if somebody doesn't think in the English language, their ability to being able to recognize what I'm even saying when I say the word autism might not be there. And that creates again another bit of a tension about how do you then move forward with some sort of shared understanding about what the child might be demonstrating in a clinic visit versus home versus school, and again across those different environments.
Now, Dr. Mohammad, you're a clinician, so you deal with autistic patients all the time. What is your advice for an individual just, walking around? They might encounter somebody who's disabled. It might be visible or not, but how do they? How do they refer to them? How do they speak to them in a way that is respectful and with dignity, and in a way that they want, the individual that they're speaking to wants to be addressed as?
Yeah, so I think you ask a really good question, and you raise a couple of good points. I think the first most important point is to always address the individual themselves. I think many times in our experiences clinically, for instance, and in other settings, we often will address or ask questions to the caregiver who's with a person who's perhaps higher needs in different settings. acknowledging the individual is probably the first best step, right? Talking directly to them. And often in that situation, if the individual is verbal enough, they'll be able to communicate. If they aren't able to, you can ask for clarification, right? You can say, I did not quite understand that. Could you please clarify? And sometimes families will, the individual might then refer to their caregiver or families for an ongoing conversation. So I think, first of all, acknowledge the individual, perhaps probably the most important piece. You don't want to go in with any preconceived notions, right, of what an individual can or cannot do. And so you want to interact and recognize that, yes, there might be challenges that are presented as you begin an interaction, but going into that interaction with a full kind of awareness of this is, again, a human being who may have certain difficulties is important. And then I think the other thing is to continue to be aware of, the recognition that there's diversity, right? We have lots of diversity in disability in the sense that, you might have somebody who has challenges with their walking. And what we're told, again, in our training and in our practice is a good question is that, may I assist you if somebody is having difficulty? If you're noticing that, somebody is having a certain challenge, getting to a place or doing a certain activity, using that may I assist you language is probably most helpful, because it's framed as a question and you're not going to immediately assume that they need that help, because I think assumptions can create certain challenges when you're interacting with individuals who may have a variety of different disabilities.
Lots more we could talk about, but thank you, Dr. Mohammad, for exposing us to this new field of debate, the language of disability. Thank you for that.
Great, thank you.